Hello, everyone. My name is Dr. Murat Topoglu. As a medical doctor who works in Istanbul, Turkey, I have been practicing for 38 years acupuncture, and my specialties is obesity and headaches. So I will present the headaches today with how to treat with acupuncture headaches, right? I had over 1,000 patients in my life for different kinds of headaches, such as muscular headaches and migraine and Norton syndromes and stress muscles, stress headaches and cervical problems, headaches, and so on. So how we will, it is a subjective issues, as we know, the headaches, okay? It can be symptoms, acute or chronic, the headaches, right? If a headache is a symptoms of disease, such as brain tumor, tonsillitis, myopia, acute otitis media, it is necessary to first eliminate the cause of therefore medical treatments. Therefore, the headaches ends with the disappearance of the cause. So, in which types of headaches should acupuncture be applied? These are mainly in all kinds of migraine and all other vascular headaches, tensions, muscles itching headaches, or sinusitis, acute or chronic. Antibiotics can be added or not in this
Sir,
treatment.
slides are not moving.
Sorry,
Slides are not moving.
slice is not moving.
No, your only title is we can see.
Okay, let me. All right, let me see. Um, I cannot. I don't know how it cannot move
Uh,
with.
Now it's moving, Dr. Murat. Now you
Huh?
can slide number 4. Yes.
Okay, now it's moving.
Yes, now
Yes.
moving number
Please.
4 is there.
Number 4.
Yes.
Okay. The migraines, if it's a symptoms of brain tumor, tonsillitis, and myopia, acute otitis media, etc., it's a necessary to first eliminate the cause. Therefore, medical treatments can be applied. Therefore, the headaches ends with the disappearance of the cause. So, in which types of headaches should be acupuncture be applied? These are mainly. Now, the change or not? The slides.
No, the same one which was before.
Okay. Now
Yeah, now it's okay.
it's okay. Now, okay, I have to change. I cannot change in the screen, then I will change. Go back and screen. Okay. In all kinds of migraine, muscular headaches, tensions, headaches, sinusitis, antibiotics can be added or not. The headaches due to neck calcification. Indeed, even today, migraine does not respond to medical treatments. Acupuncture, which has been applied for 5,000 years and taught as a branch in all hospitals in China, gives a good results to 75 to 90 percent in migraine. Acupuncture treatment should be continued for continue for 3 or sometimes 6 months. Acupuncture in migraine is in the form of sessions, and the sessions duration should be started as half an hour a day and continued. Okay, the next slide. So, classification of the headaches. According to traditional Chinese medicines, headaches can be divided into two main groups. as a traditional medicine. But one of them is exogenic factors, and the other one endogenous factors. The exogenous factors: wind, cold, humidity, and the heat. And endogenous factors, these are usually related to the spleen and liver and kidney meridians. What is the exogenous factors? Wind or cold type. Decreased in feelings, the thirst, tongue is white and thin coating, cover and pulse, superficial, slow and tense. Key point is governor vessel under 14 and large intestine 4. All right, the next one. And the second one as exogenous factors is wind and heat type. The pain, usually with tension and cracking the head, first unilaterally, then bilaterally, increased sense of thirst, especially drinks, and red skin face, and the yellow urine and constipation. The lung is covered in yellow, pulse is superficially and rapid. Key points is also governor vessel 14 and large intestine 11. And the next slide is, all right, what is the wind and humidity type? General symptoms is headache with pressure and tension, usually frontal or general weakness, loss of appetite and feeling of fullness in the chest, and a soft stool. The tongue is white cover and sticky, pulse rolling, and key point and acupuncture point spleen 9, stomach 40, and stomach 8. And the next slide, please. And this one's coming, yes. The endogenous factors. This is a particularly relevant to the liver, kidney, and spleen. Liver, young hyperactivity. This is the most chronic headaches depends on liver, young hyperactivity. The etiology is the liver plays a very important role, especially in the free circulation of the qi. And then next slide. And if any reason, anxiety and its distress disturbs this, a qi cannot circulate normally in the body, and so it becomes blocked. The symptoms, headache, especially throbbing, such as heartbeat, and pain is mostly unilateral, hypochondriac pain, and difficulty falling asleep may accompany it, dryness in the mouth and the throat, and there is a feeling of bitterness in the tongue. And the next slide. And the tongue is red, usually thick and covered in yellow. The pulse and the acupuncture points is gallbladder 20, gallbladder 5, gallbladder 41, governor vessel 20, liver 3, spleen 6, and the large intestine 4. Additionally, for the dampness, spleen 9 in hypochondriac pains, and the pericardium 6 is for sleep disorders. And the method is the sedation method. And there is also the ear point. Ear point, we use the Shenman, liver, temporal, and anti-aggression point, which is very important. That. And what is the second chronic headaches or exogenous factors? The kidney qi deficiency. The symptoms, headache with a feeling of emptiness in the head. Dizziness, tinnitus, insomnia may accompany, mostly lower back pain. Those who will feel weak and sluggish. The tongue is pale, thinly covered in white, and the pulse is weak especially in the kidney area. And the next slide. And the treatment is generally the back alarm points and the points on the foot Shaoyin meridians should be chosen. Bladder 23, kidney 3, especially for kidney tonification, and the large intestine 4, governor vessel 20, gallbladder 39, unilateral. Method is tonification, and the ear points is kidney and the Shanman. Okay, what is the phlegm headaches? Phlegm headaches, the symptoms headache, especially with a feeling of confusion, fullness in the chest and epigastric region, may be accompanied by cough and the nausea and anorexia. The tongue usually red, covered, and with the white adhesive, and the pulse is rolling. And the treatment is pulling chi down from the above and dissolving phlegm, opening the meridian and collaterals, usually the points on the ren and the foot Yang Ming meridians are selected. Stomach aid, especially for reducing the feeling of heaviness in the head. Conception vessels 17 for chest of the fullness. Pericardium 6 for nausea. Extra 3 is in the Chinese say Taiyang. Stomach 40 for dissolving phlegm, and the large intestine 4, and the spleen 9 for dissolving moisture. The method is sedation, and the ear points is the spleen and the Shanman. And the headaches due to blood occlusion, the blood blockage. Symptoms is continuous, persistent, and simple headaches. Headaches in a piercing style, sometimes a story of trauma. The tongue is purple and slightly veiled. The pulse is like a string, and the treatment activation of blood, opening the congestion and Yangming points and the Taiyang points. Okay, then the next one. Large intestine 4, spleen 6, bladder 17, spleen 10 for blood. Bladder 2 is the bladder 2 points are here, effective for noticeable pain. And the method sedification or tonification. Ear points is Shanman, subcortex, occiput, frontal, and on the or temporal. Okay, there is lots of classification for Taiyang, Yangming, Shaoyan, and Jueyin. I speed on this. And okay, what is the vertex headache? The vertex headache is on the top. The treatment is governor vessel 20, small intestine 3, bladder 67 on the foot, liver 3 on the foot. The second treatment is governor vessel 20 and bladder 7, large liver 2, and Acupuncture points. Okay, let's if we have the frontal headaches, stomach 8 is needle direction to the backwards, and yin tang like here in the middle of the eyebrow, and governor vessel 23 and the backwards needling, a large intestine 4, and stomach 44. And the lateral headaches is the Taiyang extra 3 and triple warmer, triple energizer 3 and triple energizer 5 and gallbladder 41. This is a very important point on the foot. Occipital headaches in the backside, gallbladder 20 and bladder 10, which is very near each other's, and bladder 60, small intestine 3, and bladder 62. And some Acupuncture points. The method can be used sedative or pricking methods. Additionally, we can add plum blossom techniques, Taiyang, Yin Tang, and Acupuncture points. Cupping methods or plum blossom can be applied. And first and the second method specifically exogenic headaches, liver yang hyperactivity, or blood occlusion headaches, that we use the plum blossom and the cupping therapy. We can add also scalp acupuncture, sensorial, emotional are can be used here. An extra in frontal pain, 1.5 lower sensory is used unilaterally or bilaterally. What is the prognosis? Prognosis is a traditional Chinese medicine. After the classification is made, treatment should be started. Sometimes the headaches of patients may not be fully classified. Sometimes it can fall into both groups. In this case, the last symptoms of the disease are treated at first. It's then treated according to etiology at the onset of the disease. Okay, let's turn the other one. All right. Okay, the pain. If the pain is most every day, session should be practiced every day. Generally, after 10 or 12 sessions are applied in this way, at the beginning, the patient should be interrupted and give an interval time for 7 or 10 days. Treatment should be started with the classical acupuncture. If the pain has not changed in 3 or 4 sessions, electroacupuncture should be started immediately. In electroacupuncture, the combination of the points can take various form. For example, if the patient came to the session with a headache bilaterally, electroacupuncture can be applied to the head points. Okay, then gallbladder 14, gallbladder 20, bladder 10, bladder 2, Taiyang, stomach 8, in additional point, large intestine 4, liver 3, stomach 36, gallbladder 34, and the S distal point. In this case, electroacupuncture treatment is 30 to 45 minutes. It should be done. Even if the patient has been decreased at the end of the treatment, it should be kept in mind that the pain may start again after 2 or 4 hours later, and it should be started to the patients. Okay. When the patient comes to the second course of the treatment, if the pain is not as frequent as before, if it's less severe, it should be applied 2-3 times a week, in addition to 6 to 8 sessions. And what are the ear points? The ear points, many ear points can be used. Okay, I will tell you. The progesterone point and the ear, if the lady patient headaches increases premenstrual time, I mean, the menstruation time, if she says that my pain comes very severe when I premenstrual time, so you have to use the progesterone and sympathetic point just below. And the Shenman is very, very effective for that. On the other hand, bordiol point, estrogen point, and gallbladder, and diazepam point, thalamus, gonadotropin and the frontal, temporal, and occipit point in the ear. Sometimes the patient has the depression, so we add antidepressant points, which is called the Jerome point, and the worry point for stress, anxiety points. And we also use the master omega points. So thank you very much for listening to me. It's a very, very big conversation on headaches and the treat. So I'm giving the lectures to universities, to the doctors, how to apply the migraine and acupuncture together. So if you have any question, I would like to answer. Thank you so much. Hello? Do you hear me? Hello? All right. Okay. So it's a very, very huge subject.